So today we have an exciting package in store. Our contributors will get data bundle. So I encourage all of us to also contribute when it's time for us to do so. I mean, Dr. Owusu-Antwi is fun to listen to. So I'm sure we'll all enjoy ourselves. Let me briefly introduce Doc to us. Dr. Owusu-Antwi is a Christian. Yes, she wants to be identified as a Christian. So she's a Christian, and then a fellow of the Ghana College of Physicians and Surgeons. She holds a Bachelor of Medicine and Surgery degree, and then an MSc in Global Mental Health from KNUST. She's a lecturer at the Department of Behavioural Sciences at the School of Medicine and Dentistry. And then she's also a senior specialist at Komfo Anokye Teaching Hospital, and currently the head of the Psychiatric Unit at Komfo Anokye Teaching Hospital. And finally, she's the immediate past president of the Psychiatric Association of Ghana. Today, she's joined us to present on sleep and sleep disorders. So let us understand what sleep disorders is all about. She's a very seasoned psychiatrist, so I know we are in for the best. As I said earlier on, today is going to be fun. You have the chance, you have the opportunity to gain some data bundle if you contribute to this program. And then that'll be at the end of her presentation. We'll give room for others to also contribute or ask questions. So if you ask questions or contribute to the program, the maximum of 5 participants, you stand a chance of getting data bundle free of charge. Yay. Okay, so until then, I'm your hostess, Mrs. Esther Ohenewa, also from the Department of Behavioural Science. And I want to remind us again that this is an initiative of the KNUST Wellness Center in collaboration with the Behavioural Sciences Department, KNUST, then KNUST Counselling Center, and then St. Patrick's Hospital of Finso. St. Patrick's Hospital, specifically the Wellness Clinic at Offenso. So, Dr. Owusu-Antwi. Hello, Doc.
Good afternoon, Esther, and good afternoon to our cherished participants this afternoon.
Doc, I hope I've exhausted everything about you, because you seem to have a lot of, I don't know if I've exhausted everything.
Let's go on. This meeting is about sleep and sleep disorders. So we'll keep it as such. Kindly let me know if I'm breaking up at any point in time. I will try.
So the floor is yours, please.
Soon. Thank you very much for this opportunity. I enjoy talking about sleep. This is because since I entered into the field of psychiatry, I have realized that probably sleep is more important than money, than food, than anything else that makes us feel healthy. We take some of these things for granted. And as I go through, I would talk about what sleep is all about, some very common sleep disorders. There are a lot of sleep disorders, but because of time, I would focus on just a few of them, and how best as individuals we can maximize the quality and the quantity of our sleep. I hope my slides can be seen.
Yes, Doc, we can all see your slides.
All right, so these are the areas I'll be touching on. I will talk about normal sleep and its stages. I will talk about the functions of sleep. I will talk about the sleep cycle, what we call the sleep cycle. I will touch on what regulates sleep. And then I would talk about some common sleep disorders and end on how to improve on your sleep. Permit me to switch gadgets so that I can put on my video. So by way of introduction, everybody, irrespective of whoever sleeps. Sleep is currently a universal behavior that has been demonstrated in every animal species studied, from insects through to mammals. And it is one of the most significant human behaviors, occupying roughly 1/3 of human life. This means that if you live up to the age of 60 years, you would have slept 20 years of your life. Sleep is, interestingly, not the opposite of wakefulness. because there are many similarities between the two states. In fact, there are some things we do when we are asleep, and we do these same things when we are awake. For instance, when we are asleep, we are able to experience sensation. A nursing mother who is asleep can sense that the baby is crying and can wake up to go and attend to the baby. We would think that you would be that sensitive only when you are awake. There are some sleep problems that allow people to walk and talk in their sleep. We know that talking and walking is an activity that would have taken place only in the wakeful state. But these are just a few examples for us to understand that sleep is not directly or necessarily the opposite of wakefulness. What then is sleep? Sleep has been defined as a physiological state of unconsciousness from which an individual can be aroused without from coma. When someone is in coma, they are in a pathological state and they cannot be easily aroused. How is sleep measured? I would bore you a little bit with some of these technicalities so that we'll build a good background on this sleep topic. Sleep is measured by three major measures. There is the one we call EEG, the second one is EOG, and the third one is EMG. So electrical cords and cables and gadgets are connected to some portions of the brain or the head to measure brain waves. Some of these cords are connected to close to the eyeball, and then some others are put just at the chin and some other parts of the body to measure the extent of muscle contraction. And these measures are simultaneously done when someone is asleep. And recordings are monitored on a monitor or a PC monitor. And based on the waves that are seen, sleep can be measured, whether it is good, it is bad, or it is quality or not. Now, when these three measures are recorded simultaneously, the EEG, which is electroencephalogram, EOG, electrooculogram, and then EMG, which is electromyogram, are done simultaneously. It helps investigators or researchers to divide sleep into five different stages. So we have stage 1, stage 2, 3, 4, 5. Sleep is almost like driving a car that you put to first gear, second gear, third gear. And just like we drive a car, the latter gears you are, or the deeper stages you are, the better and the more restful your sleep. And so in my line of practice, I've seen couple come to the consulting room and maybe the wife is saying, "Oh, doctor, I am not sleeping at all." And the husband is saying, "Hey, that would die. What's the under?" And I'm like, "Daddy, you cannot argue." Sometimes people are lying down, their eyes are closed, but they are probably hovering just around. They don't feel rested. They feel they didn't sleep at all. And sometimes that is what people mean when they say that they are not.
Dr. Ruth.
Consider, yeah.
Dr. Owusu-Antwi.
So like I was saying, sleep is staged in five different stages. And the first 4 stages we call the non-REM sleep. And then the 5th stage is called the REM sleep. Again, REM sleep, non-REM sleep, and wakefulness are all different from each other. They are not necessarily opposite of each other, as we would soon find out. Now, when an individual closes their eyes and relaxes, just to retreat a little bit, we have 5 stages of sleep, stage 1 to 5. The first 4 stages we call the non-REM sleep. And then the 5th stage is called the REM sleep. Now, when an individual, I will just describe what happens when we close our eyes and we fall asleep. When we close our eyes and we relax in the bed to fall asleep, the brain waves that I described earlier with the measure of the EEG, EMG, and then EOG, they start showing some particular characteristic pattern. We call it alpha waves. Alpha waves means that it is moving at 8 to 12 hertz. Don't worry about the details of that. However, from that time when you now slip into sleep, from the alpha wave, you move into stage 1 of sleep. And at stage 1 of sleep, these brain waves become less regular and they are reduced in amplitude. From stage 2, from stage 1, the sleep moves to stage 2. And what will let you know you have reached stage 2 is that the brain waves now increases to about 12 to 16 hertz. And there are some sharp rise and falls alternating with what we call the K complexes. And then in stage 3 and 4, you would have thought that the waves will be faster. Surprisingly, during stage 3 and 4, which is the deepest portion of the non-REM stage of sleep, the brain waves start slowing down. They are as slow as 1 to 2 hertz. And these are called the delta waves. And when an individual is at stage 3 and stage 4 of the sleep, it is very difficult to awaken them up. And sometimes if you force them to wake up, there are a lot of unusual happenings. And that is when somebody's phone rings and they pick the call and all they are talking is gibberish. And sometimes they do not remember. In fact, most of the time, they do not remember they ever had a phone call with you and they talked about any subject. After about 90 minutes of sleep, that is after about 1.5 hours or so, then the sleep moves from stage 4 to stage 5. That is when you have your first REM sleep in the night. So sleep moves from stage 4 into stage 5 after about 90 minutes. And this 90 minutes is called the REM latency or, REM sleep latency. And it is more or less consistent in all normal adults. It will take almost everybody 1.5 hours to move to the very deepest portion of sleep, which is the stage 5, which is also called the REM stage of sleep. So if you know that somebody has been sleeping for about 1.5 hours, as much as possible, don't disturb their sleep. They are far gone. At the 5th stage of sleep, when you look at the brain waves that I was talking about, they move from the slow delta waves that were seen in stage 4 to extremely active waves. And these waves are so active that they look more active than when you take the brain waves of somebody who is awake. And so it makes researchers feel that just the REM stage or just the 5th stage of sleep is another form or it's a third form of existence where the body, the brain is working at a very fast rate. It's very active, even when you compare it. In fact, more active than when you compare it with someone who is awake. And at this stage of the sleep, which is the 5th stage, you will see the sleeper's eye moving rapidly under the closed eyelids. If you have shared a bed with someone, when they are at the 5th stage of sleep, beneath their closed eyelids, you will see the eyeballs rolling to and fro. And I remember when I was younger, and I see my siblings at that stage of sleep, I had always thought that they were pretending to be asleep. The truth is that they actually are the deepest portions of their sleep. Now let's compare what happens in REM sleep and then the non-REM sleep. So I've already said that stage 1 to 4 is called non-REM sleep. Non-REM simply means non-rapid eye movement sleep. And then the REM means rapid eye movement sleep, because at the REM sleep, the eyeball moves very rapidly in the eye socket. Now, in the REM sleep, a normal person is very peaceful, very restful when you compare it to waking. In non-REM, it is, I've already said, it is composed of stages 1 to 4. All physiological functions are markedly lower than in the wakeful stage. I mentioned earlier that at the deepest portion of the non-REM sleep, which is stage 3 and 4, when you wake the person up, they may exhibit some unusual arousal characteristics. They can be disoriented. When an alarm blows around that time, they wake up and they can go and stand at a wall in an attempt to open some door at some wall where there's no door. They are a bit confused and disorganized and disoriented when you wake somebody around stage 3 and 4 of the sleep. Again, in the non-REM stage of sleep, eye movement in the eyelids, under the eyelids, is virtually absent. When we check the pulse, the heart rate, respiratory rate, they are typically slowed, blood pressure tends to be low, and all muscles are relaxed. Again, in the non-REM sleep, there's episodic involuntary body movement, and that is when people may have a flicker of the hand. When people have a disorder we call the restless leg syndrome, that is when it happens around stage 3 and 4, where it will just flicker. They can move and turn themselves in bed, change their sleeping position and all that. Again, in the non-REM sleep, seldom do any penile erections occur in men. We know that in men, there's the early morning erection and all that. When they sleep as well, they experience some of these penile erection. It is a normal functioning. It doesn't mean that you are a bad boy or you are necessarily having a wet dream. It is a normal physiological function that happens in the REM stage of sleep. But in the non-REM, this does not happen. Again, in the non-REM, blood flow through most tissues, including the cerebral blood flow, is slightly reduced. And then the metabolic rate of the brain is reduced by as much as 30%. People hardly dream in the non-REM stage of sleep. If you are never dreaming, it is most likely that you hardly get to the 5th stage of sleep, because that is where all the dreams occur. A few times people may dream in the non-REM stage of sleep, but what happens is that the nature of non-REM kind of dream are things you were thinking about just before you went to bed. If you were talking about something just before you went to bed, that is what you are likely to dream about. And most of the time when you wake up, you have forgotten the details of the dream. You just remember you were dreaming about something, or what I was talking about, I took it into my dream, but you're unable to remember the details of the dream. That is the nature of the dream that happens in non-REM stage of sleep. And again, body temperature set point is lowered homeostatically. Let's see what happens in the REM stage. I've said the REM stage is the 5th stage of sleep. It is the deepest portion of sleep. REM sleep is qualitatively different kind of sleep, and it's characterized by a high level of brain activity and physiological activities that are sometimes higher than even in the wakeful stage. During the REM, there is rapid eye movement. So even though the individual's eyes are closed, you see the eyeballs rolling underneath the closed eyelids. The pulse, respiration, blood pressure in humans are all high and usually very irregular. And they are usually higher than you have even in the wakeful stage, like I've already said. Brain metabolic rate increases. Subsequently, oxygen use increases in the REM stage of sleep. And there is almost complete paralysis during the REM stage of sleep. It's only a few muscles in the heart, the diaphragm, and then smooth muscles of the eyes, and then the intestines and blood vessels that are spared. All other muscles are paralyzed. And that is the points where people experience sleep paralysis. At the 5th stage of sleep, because muscle paralysis is a normal phenomenon. When someone wakes you up at this stage of sleep, you realize that you can't move your hands, you can't move your leg, you feel paralyzed, and it is normal. All that is telling you is that you were supposed to be asleep. Just close your eyes and go back sleeping. Unfortunately, a lot of spiritual and demonic connotation has been given to sleep paralysis. In local parlance, we call emuntum or monunkum or whatever. So much so that because we are afraid of it and we do not understand, for most people, when they experience sleep paralysis, their eyes are open. They also almost all the time see some dark figure standing on them, trying to strangle them. People have shared all sorts of stories. But if you would understand that paralysis is just a normal physiological phenomenon, anytime it happens again, just close your eyes and sleep. And that fear and all the spiritual experiences and the panic that comes with it will go away. It only shows that you were at the 5th stage, or someone woke you up, or something woke you up at the 5th stage of sleep. You were not supposed to be up. Just continue with your sleep. Again, at the REM stage of sleep, body movement is absent, and this is the point where dreams occur. And the dreams that occur here are visually vivid, but they are abstract and tend to have illogical features. You are having a dream in REM stage, and that is when in the dream a goat is speaking to you. And although in the real world, you know, goats do not speak, but in the dream it looks so real. They are very illogical features. You are at one point in one time talking in your office in Ghana. The next time in the dream, you're on the streets of America. You didn't see yourself boarding any flight. Those illogical things, but although they are illogical, they seem and appear so real. So real. You feel that you are there. These are the kind of dreams you wake up and you can narrate everything. So the dreams that happen in the REM stage are very vivid. People can remember it into details, can remember almost every detail of it. Unlike the unusual dreams that sometimes will happen in the non-REM, you have forgotten, you don't remember the details. They are usually things that happen just before you went to sleep and all that. Almost every REM period in men is accompanied by a partial or full penile erection. It only shows that you are developing well, you are physiologically well, hormonally, everything is on point. Body temperature homeostasis is lost during the REM stage of sleep. But someone may ask, why is sleep important at all? The first most important reason why we should be sleeping and sleeping well is that sleep is necessary for survival. In fact, prolonged sleep deprivation leads to severe physical and cognitive impairment and even death, out of several studies that's been done. Sleep is important for restoration. When you have worked yourself and tire yourself out during the day, running about, your work, trying to make ends meet, students learning and all that. When you sleep, that is when you are to rejuvenate, restore your strength, and be able to face subsequent days. Sleep is also important for normal thermal regulation and energy conservation. In mental health, sleep also serves as a diagnostic tool. We are able to get some specific characteristics of sleep problems that are specific to some specific psychiatric disorders, and it helps us in our diagnosis. And indeed, almost a half of the complaints that will come to the psychiatrist will just come with, I cannot sleep. And it's the responsibility of the doctor to delve deeper and know what is actually behind the I cannot sleep problem. Again, without adequate sleep, performance at work and interpersonal relationships are compromised, and sleep has also been shown to protect the immune system. So if you're not sleeping well, your immune system is not that strong, you become more prone to infections and diseases. When people are exposed to prolonged periods of sleep deprivation, it leads to what we call disorganization, hallucinations, and delusions. So just because of sleep deprivation, you can start hearing voices and seeing strange images and start exhibiting psychotic symptoms. When people have not slept well at night, you meet them in the day, they are irritable, they are hypersensitive, they're listening, they get angry at you, they're on the edge, or they become lethargic. They are unable to function fully, and sleep deprivation also results in inability to consolidate complex learning. And I always tell my students that morning to your exams is the wrong time to mine, is the wrong time to stay the whole night and learn, because by morning, it will be difficult to consolidate or even to remember anything you learned in the night. It's better that you learn even up to late and wake and get some sleep before your exams. That way, recollection is better. There was a study that was done with rats that shows that sleep deprivation produces a syndrome that includes a debilitated skin appearance, lesions on the skin, increased food intake. As in the presence of weight loss, there is increased energy expenditure and decreased body temperature, and eventually these rats died. So when people fall asleep, they go through a cycle. I've already talked about the fact that there is stage 1 up to 5. That is how nature has made it. And this cycle is very regular. Some people move from stage 1, 2, 3, 4, 5. They come back, start from 2, 3, 4, 5. Some will come back and start from 3, 4, 5 and do that repeatedly throughout the whole night till morning when they eventually wake up. However, I talked about the fact that your first REM stage occurs after about 1 hour, 30 minutes, which is 90 minutes during the night. And the first REM period tends to be very short, usually lasting just 10 minutes, and then you go and start again at maybe stage 2. Later, the REM periods may last 15 to 40 minutes at a time. And most REM periods occur in the last third of the night, whereas most of the non-REM sleep occurs in the first third of the night. But these patterns change over a person's lifespan. So in neonates, very, very little babies, their REM sleep represents more than 50% of their total sleep time. And for such babies, most of the time, their sleep moves straight to REM stage. The moment they close their eyes, they move zoom to stage 5. They do not go through stage 1 to 4. But as they grow older, then their sleep starting from stage 1, 2, 3, 4 before they get to 5. But even that, they still get more of the REM stage. About 40% of their sleep now becomes REM stage. So babies sleep more because they need to develop fast and grow well. And then as children go through adulthood, the REM stage of sleep starts dropping. So from the 40% REM stage in children, when you become an adult, you are getting just about 25%. And the 25% REM as opposed to 75% non-REM stays constant till old age, when the REM stage of sleep drops to 18 or sometimes even less. And for most old people, sometimes REM stage totally disappear. So there is more frequent nighttime awakening, resulting in a natural kind of insomnia as people grow. So when your grandmother or your grandfather is constantly complaining that they cannot sleep at night or they cannot sleep, don't be in a hurry to prescribe them sleep medications. Physiologically, it is normal. There are other measures I will talk about that they will benefit from to improve their sleep rather than sleep medications. But what makes us sleep? What actually puts us to sleep? Again, studies have found out that 2 major things regulate our sleep. We have the passive regulator of sleep, which is fatigue and darkness. And then we have the active regulator of sleep. These are neurochemicals called dopamine, serotonin. Their quantities and levels in your brain will determine whether you are falling asleep or you are staying awake. Now, but we may not have too much control over the active regulators of sleep, but the passive ones we can control. The passive regulators of sleep are fatigue. When you are tired, it's easy to fall asleep, or it's easier to fall asleep. And then darkness has also been found to help us sleep. If you are sleeping and consistently sleeping in light, you probably are not sleeping at all. Again, research has found out that there is a biological switch in the brain that is controlled by light and darkness. When there is a lot of light around, this switch, which is the switch for sleep, the switch is at awake mode. And when there's darkness around, the eyes pick the darkness around, and then the switch moves to the sleep mode. So just being in a dark room helps this biological switch to move to the sleep mode and helps you to sleep well. If you are sleeping and you are sleeping in a lot of light, you are trying to sleep and yet keeping your sleep switch at the awake mode. Even if you will manage to sleep, it's likely you will hover just around stage 1 and 2, and your sleep will not be quality enough or restful enough. One of our diagnostic manuals, the DSM-5, has divided sleep disorders into 2 main types: dysomnias and parasomnias. Now, when we talk about dysomnias, it is simply referring to the quantity or the timing of sleep. So dysomnias can be too much sleep or too less sleep. What worries most people is the too less sleep, called insomnia. There are other people who also sleep too much. Such people sit in class, immediately they sit down, they doze off. They sit in church, they doze off. Surprisingly, they will sit in front of the church too, and they will doze off the moment they sit down. And jokingly, people say that, hey, it is the devil that is blowing air on their eyes. I beg, let's leave the devil out of this one. Such people may be going through or experiencing hypersomnia. So what is insomnia? Insomnia is a perceived dissatisfaction with sleep quantity and sometimes the quality. And we can have primary insomnia or secondary insomnia. There's a third type of insomnia we call circadian rhythm sleep disturbance. I will not go into that. Primary insomnia means that there is no underlying problem, or there's no underlying cause. The main problem is just the insomnia. But when you have secondary insomnia, it means that there is another disorder that is causing the insomnia, or that is causing the sleeplessness. Hypersomnia, on the other hand, represents conditions that are clinically expressed as excessive sleepiness, as I've already described. When people have insomnia, they keep complaining that they are dissatisfied with their sleep quantity. Some will say that, doctor, for 5 years, and sometimes I wonder, how are you surviving 5 good years? Well, but that shows how worried and how bothersome their inability to sleep is to them. People complain that they cannot sleep, most of the time are going through insomnia. But for you to make a diagnosis of insomnia, the sleep difficulty should be occurring at least 3 nights per week. It must have been present for at least 3 months and must be persistent despite adequate opportunity to sleep. It's not that you are doing a night job or you are not being permitted to sleep, that's why you can't sleep. So we can't attribute your sleeplessness to inadequate opportunity to sleep. Neither can we attribute your sleeplessness to to a substance abuse or a medication that you are taking. When people complain that they cannot sleep, usually 3 things are happening. Either they are struggling to start the sleep. We call it initial insomnia. They struggle to even fall asleep. So they will say that when I go and lie down in bed, the sleep doesn't even come at all. Other times, they're able to fall asleep, but in 30 minutes, in 1 hour maximum, they are up again. They stay up for about 2 hours and doze off back into sleep. They sleep 30 minutes, they are up. So throughout the night, it is sleep, wake, sleep, wake. We call it difficulty maintaining sleep, which is called middle insomnia. And for other people too, they can initiate the sleep, they can maintain it, but they keep on waking up about 2 hours before the time they wish to wake up. So if this is someone who will usually wake up at 5 a.m. every day, when they start getting into insomnia or problems with insomnia, all of a sudden by 3 a.m. they are up and they can't sleep again. We call that late insomnia. If a patient or anybody is experiencing any of these characteristics, it is still classified as insomnia. How do we manage insomnia? Cognitive behavioral therapy, which is usually offered by experienced clinical psychologists, has been found to be very helpful. When you come to the Department of Behavioural Sciences, we have seasoned clinical psychologists, or when you go to the Psychiatry Unit at CAT, there are seasoned clinical psychologists that can take you to through CBT. And then what we call sleep hygiene. Sleep hygiene will be about my last but one slide. I'll share with you what are some of the things you can do aside CBT or aside taking medications to help you to sleep. And I would always recommend that a patient is taken through sleep hygiene before we attempt any other form of remedy. And then there are some drugs we call the Z drugs, zolpidem, zapilum. These are prescription drugs, low dose quetiapine. They can only be given to you by a qualified physician, psychiatrist, or practitioner for you to get. Then we have the secondary insomnia, and I describe secondary insomnia as sleep difficulties that are caused by other underlying problems. We have anxiety disorders. There can be muscular aches and pains as a result of a muscular problem. Just environmental changes. You move from one locality to another, especially Form 1 boys, Form 1 girls. They move from home to first year in secondary school. Just the environmental changes can affect their sleep. Or you relocate to another country, can also affect your sleep. Depression has been found to cause sleep problems. Post-traumatic stress disorder and schizophrenia are all disorders or conditions that can result in sleep problems or in insomnia. And here, when you treat the underlying disorder, usually the sleep problem also resolves. So let's zoom into hypersomnia, too much sleep. It is defined as self-reported excessive sleepiness despite a main sleep period lasting at least 7 hours. And when people have insomnia, after they have slept for 7 hours, they also complain of excessive difficulty in remaining awake, with a tendency to remain in bed for usually long periods of time, going usually more than 9 hours. Some go like 12 hours. And even after the 12 hours, they have the tendency of frequently napping during the day. If anyone experiences this, we should not take it for granted. They should get expert help. Hypersomnia has been found to be as a result of absent or low levels of a hormone we call, or neurochemical we call, hypocretin in the CSF. Sometimes it is genetic also. It runs through families. It's very familial. In other jurisdictions, viral infections, and then head trauma has been found to be a cause of hypersomnia. Hypersomnia is characterized by recurrent periods of sleep or lapses into sleep within the same day, a prolonged main sleep which goes beyond 9 hours, and it is non-restorative. You have slept this long and you still feel unrefreshed. Falling asleep sooner than usual and difficulty arising in the morning are all characteristics of hypersomnia. It is treatable. The treatment consists of stimulant drugs, and all these drugs are prescription drugs that can only be given by a qualified practitioner. So I said there is dysomnias and parasomnias. Now let's talk about the parasomnias. Parasomnias are unusual or undesirable phenomenon that appear suddenly during your sleep. And so because movement or paralysis occurs during the 5th stage of sleep, Most of these parasomnias occur around the 3rd and the 4th stage of sleep. And I remember I said that things that happen around the 3rd and 4th stage, people are unable to recall. And so they will wake up and they don't recall any of the actions that took place during the sleep. And so some of these parasomnias include sleepwalking, sleep terrors, restless leg syndrome, etc. I'll talk about just a few. Sleepwalking. These are repeated episodes of rising from bed during sleep and walking about. While sleepwalking, the individual will usually have a blank stare. They are relatively unresponsive because they are actually still asleep. You will try to call them, talk to them, engage them. They will not respond because they are technically asleep. We have sleep eating, so they can wake up, go to the fridge and eat your food and go back to sleep. And when you are asking them in the morning, they would deny, not because they are necessarily lying, but they don't remember they did that. There are other sleep-related sexual behaviors that can occur and people will not recall at all. Another parasomnia is sleep terrors. These are recurrent episodes of abrupt terror arousal from sleep, usually beginning with a panicky scream. So someone is asleep and they suddenly start screaming with an intense fear. They are shaking, their heart is beating fast, and all attempts to calm them down is very difficult because, like I said, technically they are still asleep and yet they feel afraid. And unlike a nightmare, when it is a sleep terror, you ask them what is scaring you, what is making you wake up from your dream scared. They don't remember because it happened around stage 3 and 4. And then lastly, the restless leg syndrome is characterized by a desire to move the legs or arm during sleep. When people have RLS, their hand can flicker while they are asleep, their leg will just flicker while they are asleep. And these symptoms result in delay in onset of sleep because just when you are trying to doze into sleep, then your leg or your hand will flicker and you flicker and you wake up. Or when the people have even fallen asleep, the repeated flickers of the hand and arms disturb their sleep and they keep waking up and their sleep is not quality enough. So what are some of the measures we can do to induce good sleep, to make sure that our sleep is quality enough, is restful enough, to make sure that we are getting to the deepest portions of sleep, which will make us, which will restore us? The first one is to make sure that we arise at the same time daily. If you wake up at 6 every day, keep to that routine. It's very helpful. Don't attempt to stay longer in bed thinking that I want to have more sleep because I think I didn't sleep well. Train your body to be out of bed at the same time. Go to bed at the same time and arise at the same time. Limit daily in-bed time to the usual amount present before your sleep disturbance. And discontinue central nervous system acting drugs, central nervous system acting drugs like caffeine, nicotine, alcohol, close to bedtime. If you are taking caffeine, you take tea or coffee, or you smoke, or you take alcohol close to your bedtime. These are substances or chemicals that are stimulants. They are supposed to keep you awake. And so when you take it to close to your bedtime, it's likely to affect your sleep. Avoid the temptation to have naps during the afternoon if you want your nighttime sleep to be very good. If you have any nap at all, limit it to about 30 minutes at a time and ensure that the nap is before 3 p.m. After 3 p.m., if you are napping, it is likely to negatively impact on the quality of your sleep at night. And for adults, it's advisable to get 7 hours of sleep at least 4 days in a week. Earlier research had said that all adults should sleep 8 hours a day, 7 days in a week. Recent research has shown that it's overambitious and may not be achieved by any adult. And however, if adults are able to get 7 hours of sleep, at least 4 days out of the 7 days in the week, they will still be able to reduce their stress levels. They will still have restoration. They will still be able to stay healthy. However, if you do not make this 7 hours, 4 days in the week, then you are in a sleep debt. you are in a debt of sleep and you will need to make up for the lost time quickly. And just 3 or 4 nights of an extended sleep whenever you have a sleep debt is advisable. In fact, every hour of sleep debt requires almost 4 hours of sleep for recovery. And so if you do not make the mark of 7 hours for 4 days, then you have to choose one of the days and go beyond the 7 hours that is required. Also, to help with your sleep, establish physical fitness by means of a graded program of vigorous exercises early in the day, not close to your bedtime. And then get a consistent and routine bedtime activities, and that starts around 15 to 60 minutes before your bedtime. That is a way to cue your brain that you are getting closer to your bedtime. And if you do it this consistently, that every time you're about to sleep, you shower, you go and lie down in your bed, you put on some instrumentals or some quiet music, you put off your light, you go and lie down. These measures will become routine and your brain will take cues from that and start preparing your body for sleep. Also, reduce or in fact, avoid screens before bed. I've already told you what light does to sleep switch. And so if you're on your phone or you're on a gadget, you're on TV, close to your bedtime, or you think that you want to sleep and yet you're on your phone or watching TV, all you're doing is throwing light into your eyes, causing your sleep switch to be at the awake mode, and that can unnecessarily delay your sleep or give you poor quality sleep. Also, avoid evening stimulations, and instead of watching a movie, an action movie close to your bedtime, we advise that substitute it for listening to something calm on radio close to your bedtime. It's also advisable to try very hot 20 minutes body temperature raising bath soak near your bedtime. So in the evenings, if you want to have good sleep, make sure that you are using warm water rather than a shower. Unfortunately, in the advent of doomsday and the heat in the system, people will be tempted to do a cold shower, but that is, if you already have a sleep problem, that would not be advisable. Also, for good sleep, eat at regular times daily and avoid large meals close to your bedtime. Practice evening relaxation routines such as progressive muscle relaxation, meditation, and maintain comfortable sleeping condition. Young man, you don't expect to sleep if you have turned half of your bed into your wardrobe. Your belt, your trousers, your boxer shorts is lying on one side. In fact, you are not even sleeping on a bed sheet and your pillowcase is as dirty as something. That is not a comfortable sleeping condition, and that adversely affects the quality of sleep. So it's important that our surroundings in our bedrooms are very clean and comfortable. That in itself helps with the sleep. Avoid doing important tasks just before bedtime. For instance, close to bedtime is when you are paying your bills or when you are studying. If you are studying, get out of bed, go and sit on your study table, finish the studying, close your book, come to your bed, and maybe listen to something cool or calming for about 30 minutes before you go to bed. Don't just lie on your bed studying and expect to drift into sleep. So avoid using your bed for things other than sleeping or sex. For instance, avoid reading in bed, avoid eating in bed, and avoid studying in bed. If you would limit your sleep, your bed to just particular things, just sleep. The moment you get into your bed, your mind and your body would understand that you are in bed just for one thing, for sleep, and not for anything else. In conclusion, sleep is a basic necessity of life, and there is a strong link between sleep and physical and mental health, with sleep having been shown to be the biggest single contributor to living healthy. Our lifestyles and environmental factors considerably impact our sleep quality. In this 21st century, we live in a fast-paced society, and sleep is often sacrificed and not prioritized as much as it should be. But when we say someone should have good sleep, then we are referring to someone who falls asleep easily, Do not fully wake up during the night. Do not wake up too early and feels refreshed in the morning. I would end with this passage from the good book, Psalm 127, verse 2. It is waste of time to get up early and stay up late, trying to make a living, for God provides for those he loves, even in their sleep. And I believe that God loves us all. Thank you very much for listening.
Oh, thank you very much, Doc. And just as I said, it's always amazing listening to her. She has a way of making engaging her audience. She's just good like that. Doc, thank you very much for the presentation. So someone just sent to me that Ms. Ahenowa, at the beginning of the entire program,
Esther, over to you.
Yes, so I've already started talking. Even before you said over to me. Thank you very much, Doc, for your presentation. Just before the start of the presentation, someone sent to me that Ms. Ahenowa, you didn't say welcome
Ms.
to Psyche.
Over to you. Thank you.
I'm feeling, Doc, you're deliberately doing this. So yes, welcome to Psygist. Let me just say it now. I don't know what's wrong with my video, but I can't seem to see anything on my screen. Welcome to Psygist, and thank you very much, Ruth Owusu-Antwi, for the wonderful presentation. We've learned a lot from it. Thank you so very much. You've really enlightened us, and I hope we get to sleep better, or we get to go easy on ourselves when we have sleep issues. We know who to go to. We know how to address it. Thank you very much. Just as I said at the beginning of this presentation, we have wonderful packages in store. So now, yeah, sorry about that. So at the beginning of this presentation, this webinar, I said that today we have wonderful packages in store. If you're able to contribute to the program, you stand a chance of getting free data bundle. You just have to drop your number in the chat column the minute you start to give your ask a question or contribute to it so that we can capture it. So someone just sent it, just as I was saying, someone just sent me a message that, Mr. Ahenowa, you didn't say welcome to Psygist and all that. We are not presenters by age, so we are all learning. So welcome to Psygist, where we are. Someone sent me a slogan, but I've forgotten. Doc, if you can please send the slogan to me again, I would say it for everyone to hear. Welcome to Psygist, and thank you, Dr. Owusu-Antwi, for the wonderful presentation. I said that the minute you have the floor, it's all fireworks all over. So thank you. So Doc is on standby for questions. You can just ask your question, unmute, and then ask your question. If you want to say anything, unmute, then you say it. Just 5 people, then we are done. So in the chat we have Mr. Amweni asking, is sleep paralysis a sleep disorder or spiritual phenomenon, as most believe? Doc, that's over to you. Dr. Owusu-Antwi.
Yes, can you hear me?
Yes, please, we can hear you.
I spent just a little bit more time stressing on the fact that sleep paralysis is not a disorder. It's a normal physiological disorder that occurs at the 5th stage of sleep. And so people should not be scared. They should not be afraid. At the 5th stage of sleep, which is the REM sleep, most of the muscles, the major muscles, are paralyzed. And so when you wake up and you cannot move your hands and your legs, it's only because you woke up at the time that you were actually supposed to be sleeping. Just close your eyes and go back to sleep. But like I explained earlier, we have been given all sorts of explanations about sleep paralysis that we get scared when it happens to us, such that because of our cognitive formation and understanding of that phenomenon, almost every time an individual experiences sleep paralysis, they are also seeing a huge image in their room or someone trying to strangle them and whatsoever. If you can take it from this webinar, that sleep paralysis is not a demonic attack. Anytime it happens to you, you just go back to sleep. You realize that it may stop, or you'll not even be afraid again. And because you are not afraid, those images, demons and giants you see in your room would also stop coming. So sleep paralysis is a normal physiological phenomenon. You were supposed to be sleeping. Just go back and sleep. Thank you.
Okay, thank you. So let me take 2 additional questions from the chat. Then I'll give the opportunity for people to unmute and then ask their questions as well. So if you want to speak, you just put your hand up in the chat column. Yes, I can see some hands up. I will call you guys shortly. Let me just ask these 2 questions in the chat. At what stage of our sleep can we take our dreams seriously? At what stage in our sleep can we take our dreams serious?
So can we take our dreams serious? I'm not sure what I understand by serious. I don't know whether you want to say, can we say that the dream is true or not? That one is for the pastors. I am a psychiatrist, although I double as Sofumame, I am unable to explain dreams. But the distinction between the dreams that happen at the different stages is what I explained, that rarely dreams can occur around stage 3 and 4, rarely. But usually they are, I'll say, nonsensical dreams. If you were arguing with your partner, you may dream about it. If you were talking about work just before you fell asleep, you may dream about it. And usually you don't even remember the details of that dream. But proper dreams occur in stage 5, which is the REM stage of sleep. And it is usually very vivid. And I suspect that if even God wants to reveal something to you through your dreams, that is the time he will bring that dream, because they are very real, but they contain a lot of illogical things. Like I said, that is when the goat is speaking, that is when you are here, your next scene, you're in America, it's like you are behind a large screen, TV screen, seeing things unfolding, or you yourself, a major actor of a movie. It feels so real. People have cried in dreams in the 5th stage, and they wake up and there's actually tears in their eyes. Okay, so the 5th stage is the stage where people have dreams, but I cannot say that every 5th stage dream would indeed come to pass, or it's a warning and all that. I have another lecture on dreams. Maybe at another day we can talk about dreams.
Yes, that's something you can arrange. So just to add up, as a therapist, this is what we've realized. So for most of our sleeps, you can always our dreams, you can always trace them back to discussions we've had in the course of the day, or just before we slept, or even movies we've watched. Okay, these things have impact on the kind of dreams we dream. Okay, so you can have a horror dream and then you go like, I wasn't discussing anything horrible just before sleep, or I didn't watch any horrific movie before sleep. But then if you reflect on what you did in the course of the day, or prior that, before that particular day, you'd realize you've had some discussions centered around that, and that could impact on the kind of dream you have. There are a lot of questions over in the chat, but let me unmute others to also ask their questions so that I can go back to what we have in the chat, please. So Mr. Mark, you can unmute yourself and then ask your question. Your hand is up.
Okay, thank you very much. I'm Dr. Bafua Jima Ramsia. I wanted to ask Mrs. Antwi, how long can we stay awake? I heard that recently there were some kind of competitions in Ghana called Singathon and what, and people were patronizing it. So, in fact, I got worried because I don't know how long we can stay awake and still be healthy. The second thing too is, the second question I want to ask from her, is sleep related to death? Thank you.
Is sleep related to what, please?
Death.
Death. Oh, okay.
Yes.
Okay.
Thank you.
So I have my senior colleagues.
Yes,
yeah, okay.
Yes, go ahead.
No, Dr. Owusu-Antwi, you can. I just wanted to say other colleagues can jump in to assist with the answers if they choose to. Dr. Owusu-Antwi, please, you can.
Yes, thank you very much. So there's actually a limit to how far you can go without sleep, and beyond which point you will start experiencing the abnormalities I talked in the study that was done in rats. I've forgotten exactly how long this is. If anybody knows the exact duration, they can share with us. But sleeplessness after a particular duration can lead to death. You can be physically well, BP fine, no sickness, no disease. Just sleep deprivation after a period can give you that can result in death. During that period, you can be eating well as well and all that. So this are tons that are going on. I have also been worried, but I realized that most of these people have the medical team with them. There was one particular team that I realized that there were actually psychiatrists part of the team, and I'm not sure the details of what they did to support the sleeplessness, but if people have to go on any of these marathons, they must consult their doctors. They must have their medical team on ground to give them the necessary support, medications, strategies, so that they do not suffer the repercussions of the sleeplessness that goes with such marathons. And then you ask whether sleep is related to death. I'm not sure whether I understand that question. Is it because people give the proverb that I don't know whether that is where your question is from, but definitely sleep is different from death. When you are dead, you are unarousable. When you are asleep, I explained and defined sleep as a physiological state from which one can be aroused from.
Hello.
Hello.
Yes. Okay. So, Mr. Doc, thank you for this information. Mr. Christopher Addo, please, you can ask your question.
Okay. So thank you very much. I just wanted to know, what about excessive yawning? Does it have anything to do with sleep disorders? Like you yawn too much. Is there something you are supposed to look out for, check, or do something?
I mean, if you yawn too much, it's an indication that you are not having a restful sleep. But then let me leave it to Dr. Owusu-Antwi to respond to that. Doc.
Okay, so when people are feeling sleepy, they yawn. That is one cause of yawning. So if you are yawning a lot, are you feeling sleepy as well? And that may give an indication that you are probably experiencing some degree of hypersomnia. But there are some people who yawn, but they do not necessarily feel sleepy. And there are a lot of medication or a number of medications that give such side effects, especially some notable antidepressants. Their side effect is excessive yawning. And so if you are worried, if this is something that is new in your life, you may want to get an assessment with a therapist or with a physician to make sure that you are not experiencing any sleep problem, or you are not reacting to any medication or any substance or food that you are taking in.
Okay, so hello, Doc. So the question.
Yes, Esther. Yeah.
Yes. Sorry about that. There was a technical challenge. There's a question in the chat. Someone wanted to find out that if insomnia is okay in the first trimester of pregnancy.
So yes, it is not normal, but it is a physiological occurrence that is common in the first trimester. In the first trimester, one of the things that account for this is the low levels of folate in the pregnant mother. Low levels of folate has been found to cause what we call the restless leg syndrome. So you may not know or may not be sure whether that is what is keeping you awake, but your hand is flickering, your leg is flickering, and every time jerking you to wake up. So you wake up and then you have had a lot of poor sleep maintenance. You feel unrested and all that. But the hormonal changes itself may also be a factor. I am not an expert obstetrician, so I may not know the details of all the other causes or hormonal changes that result in those sleeplessness. But even if you are in your first trimester, you are not sleeping well,
Don't accept it. Don't keep quiet about it. Talk to your obstetrician, and they may be able to show you some strategies to help you have a good sleep, because you need the good sleep for yourself and for the growing baby inside of you.
Okay, thank you. Thank you. So I think the next question is, I can't sleep in the afternoon. If I do that, I feel weak as if I'm sick. Please, what about that too?
Okay, so if you cannot sleep in the afternoon, we are not worried.
So if you cannot sleep in the afternoon, it's okay. We are not worried. The time we'll be worried about your sleeplessness will be at night. Okay. And so for you, you have had an indication that sleeping in the afternoon even gives you untoward side effects. Desist from it. Unless you are, your schedule or your work is such that you do daytime work and sometimes you do nighttime work. So when you have night shift, you want to be able to spend your daytime sleeping. And then you will be concerned about being able to sleep well. And in that case, please make sure that you are able to create a miniature night scenario around you. Use very thick curtains that will not allow light into your room, so that you can have a sleep as restful enough as you would have had it at night. Otherwise, you will keep having non-quality afternoon sleep, and in your case, you will even feel weak and all the side effects or the repercussions you are getting. So please, if there is no reason for you to sleep in the afternoon, and for you it doesn't work for you, then desist from sleeping in the afternoon. It doesn't add up to anything. Rather, make more efforts to have a good sleep at night, because that is the time you are likely to have a more restful sleep. And people have asked whether if I can't sleep in the night and I can sleep in the afternoon, is it the same? And it's a big no, because of the lightening environment we have. Make sure that by all means you get some nighttime sleep as well, because those times are likely to give you more quality sleep than daytime.
Okay, so the next question, let me read it out for us. I happened to visit the hospital suffering from hypertension, and the specialist insisted BP machine on my body to take it home. After 24 hours of their monitoring, the result was that my BP rises when I'm sleeping. What could that be? That's the first part. Sometimes I feel I will sleep and never wake up again. So sorry about that. In fact, I can even get tired when I'm sleeping, and I have to wake up and sit for some time before I continue my sleep. Over to you, doctor.
So if your BP is going up at the time you are sleeping, you realize the stages of sleep that sleep I talked about. At the fifth stage of sleep, your BP, your pulse, your respiratory rate are all about 30% higher than even in the wakeful stage. So it's one of several things. Either your BP rises at the time you are in the fifth stage of sleep, or the BP goes up during a time you are having a nightmare, and the nightmares will usually be accompanied by autonomic presentations. Your heart is beating fast because maybe some wild animal is chasing you, or you are at the edge of a pit you're about to fall in. You would feel all those the fear and fright symptoms even though you are asleep. Probably that is the time your BP goes up. But if it is none of these, then talk to your doctor again, explain how you feel. Let them explain why your BP is consistently going up. If they're able to measure, once it's called a Holter, 24-hour Holter, they will be able to tell at which time you fell asleep and at which time the BP started going up. If it is after the 1.5 hours, which is the 90 minutes, it's likely that you had slipped into your fifth stage of sleep, and that is not abnormal. If that is the case, then it's not abnormal. However, let's get that investigated. Thank you.
Okay, I feel like we don't want to leave this forum. Okay, so have I captured every question? I hope I have. Okay, so the last two questions, please. Dr. Ruth, very insightful presentation. In your delivery, you mentioned that one sleep cycle takes about 90 minutes. Will it then be reasonable to time our sleeps to multiples of 90 minutes? For example, having to set our alarms to wake us up every 90 minutes, I think. Yes. every 90 minutes. Would that be advisable?
I'm sorry if I didn't come across clearly, but I didn't say that every sleep cycle is 90 minutes. What I said was that we have the 5 stages of sleep. Stage 1 to 4 is called the non-REM stage of sleep, and then stage 5 is called the REM stage. You get your first REM stage after 90 minutes. Okay, so if you have slept for about 1.5 hours, people around who know what time you went to sleep and they know that you have been sleeping for about 90 minutes, they will know that, okay, this person has reached the deepest portion of sleep. And the caution is that don't disturb the person. They are having the most restorative part of their sleep. And again, the first REM stage is the shortest. It can be just 5 to 10 minutes before the cycle starts again, and it's different from everybody. It's the 90 minutes that is constant for almost all adults. The 90 minutes is called the REM latency period, and it is the first time you get your first REM stage in your cycle of sleep. So you can move after the 90 minutes when you've had the first REM, which can last for about 10 minutes. You can come and start the sleeper stage 2, go to 3, 4. From that time onwards, the sleep cycle is different from one person to the other based on your age and all that, your sleeping environment and all that. But it's the 90 minutes that is constant for everybody. And why would you set your alarm at the 90 minutes? That is the time you are just about to slip into stage 5. I don't think you want to wake up at that time. Unfortunately, if you wake up at that time, you may wake up with a sleep paralysis. So I will not advise you to set your alarm at that time.
Okay, so the last question, then we are done for the day. Thank you for the presentation. Please, I have a quick question. Is there a relationship between sleep and gaining weight?
So there is a hormone called the growth hormone that is secreted in its maximum only when you have slept. And so if you are not sleeping, one, you will develop stunted growth. You will not be growing well. And if you are sleeping excessively, then you are secreting excessive levels of growth hormone, which may result in weight gain and all that. But weight gain particularly is linked with our diet more than our sleep. Unless you are sleeping, you are eating late and not exercising and then going to bed. That one, you will gain weight because you slept, you ate heavily close to your bedtime. But in general, what affects our weight is the when and the what we are eating more than our sleep.
Okay, thank you very much. I think we've all had fun on this platform. Thank you very much, Dr. Ruth Owusu-Antwi. As usual, it's always a pleasure having you talk about these mental health issues. So for our next session, which is on the 28th of March, we have Mrs. Bernice Piasa, who is a counseling psychologist from the KNUST Counseling Center. Remember, this initiative is the collaborative effort of KNUST Wellness Center, Behavioral Science Department, KNUST, the Counseling Center, KNUST Counseling Center, and then St. Patrick's Wellness Clinic. So we'll have a counseling psychologist give us a presentation on interpersonal conflict, basically emotional intelligence, how to handle interpersonal conflict in the work setting, the work environment. That I know that will be an exciting presentation that you don't want to miss out on, because these things have significant impact on our mental health. Most of us have issues, mental health issues, because of things we can't handle with our colleagues, our interpersonal issues that we can't handle, we are unable to handle well. And we have Mrs. Piasa to walk us through this, help us, guide us on what to do in the work environment so that we can have optimal mental health. Make it a date, make it a point, block that day for us so that we can engage ourselves once again. Until then, those of us who have received our reports on our mental health assessment, please work on them. Those who are yet to fill out the reports for us, the assessment, tools for us to give us for them to receive feedback, please do so. please, I entreat you to fill it out so that you can have feedback on your sleep patterns and then what to do. This month, we'll send out another assessment for us to fill. Remember, the main goal is to help us have optimal mental health. So all these series of initiatives is so we can have improved mental health in the work environment, in the home environment, in every aspect of our lives. Until we meet next week, it is bye for now. Psychist. Bye-bye.